Yeah, Doug, and as you just read there, and you can see right here on our wall, more than 5,000 new cases today. And this is an upward trend that has a lot of local doctors a bit concerned. If we want to zoom in here on a local level using our COVID mapping software and looking at the West Michigan area, there were 816 new cases reported just today. Zooming in even more, Kent County, 210 new cases, Muskegon, 42, and then over in Ottawa, 135 new cases. The bigger issue, though, is if we start to see hospitalizations creep up, too, which is something that we are already starting to see.
We had a pretty good low for January and February and started to see an increase in March.
Which is where we find ourselves now. The state recording its highest number of new cases of 2021 this week.
When we look at the graphs of positivity and our inpatient census, they are matching up very closely with what we saw in the fall. And so we are concerned that is this a third kind of peak that we're going to see or a third surge that we're going to see. So we're taking the situation very seriously.
Dr. Josh Koistra, the chief medical officer for Spectrum Health West Michigan, says their hospitalizations are going up too.
Over the last 2 weeks, our inpatient census has actually doubled. So we've gone from about 45 inpatients all the way up to 90.
Those numbers much lower for Mercy Health Muskegon with just 10 inpatients.
I wouldn't be surprised if in the next week or few weeks from now, we start seeing a rise in our cases.
The director of infection prevention for the hospital, Dr. Claudia Giron, says what's different from our fall spike is the average age of those getting sick and vaccination efforts.
It's great to know that a quarter of our population here in Muskegon has received the vaccine. So that's great. And especially a big percentage of our older population who are over 65 have received the vaccine. So I think certainly this has an impact in our hospitalizations because, as we all know, those who are older are at higher risk for moderate to severe disease.
Both doctors say increased travel, COVID fatigue, and variants are all contributing to the spike.
I think the last I checked, we were almost up to 1,000 identified cases of it in the state of Michigan. We know that it is more communicable or easier to spread from person to person. And so that certainly is at play.
And while warmer weather is almost here in West Michigan, they worry if this trend continues, the state will have to implement more restrictions yet again.
It's kind of a race with vaccines. We need to get vaccines in as many people as possible. And with that, my hope is that we won't have to have those restrictions in place.
I still think that we need to be vigilant and very cautious. We still need to follow the, infection prevention measures, including mask usage, including hand hygiene and keeping your distance.
And a reminder, all Michiganders 16 and older become eligible for the vaccine on April 5th, but you are encouraged to sign up right now and get your name in the system. You can register for the Mass Clinic at DeVos Place at vaccinatewestmi.com. They also have links to all the local health departments. You can also register at Spectrum Health and Mercy Health individually. Doug?